Good morning, everyone. I'm here to talk about a needs assessment we're conducting with the support of the World Bank, and also I want to recognize the rest of my team, and particularly Claire Brindis, who is not able to be here today. So as a background, and Jenny did a great job already explaining the World Bank's priority areas in terms of adolescent sexual and reproductive health and the broader reproductive health priority areas. But one of the things we're most delighted with in this new perspective of the World Bank is the recognition that adolescent sexual and reproductive health is really a development issue as opposed to looking at it strictly in a more biomedical model. For this purpose, we conducted a needs assessment specifically focusing on Ethiopia. We're also conducting a similar assessment in Nicaragua right now. And that needs assessment encompassed both interviews with individuals in Ethiopia, a review of all of the existing literature looking at adolescent health in Ethiopia, and also a DHS analysis, which I'll get into a little bit later. So we consider the issue of adolescent reproductive health really in a social ecology model, recognizing that the decision-making of an individual is so incredibly constrained or enabled by the other factors from both their partners, their peers, their family members, whether or not they're able to attend school, what type of policies are available, for example, in Ethiopia, while there are restrictions of child marriage, whether or not those are enforced or supported. And of course, health access, what types of services are even available in that area. So these are just a couple quick slides looking at Ethiopia in comparison to some of the other countries we're assessing. And as Maggie did a great job describing, issues of child marriage or early marriage are directly related to the level of education. You can see here in all of the countries we were assessing, the individuals who have no education were much, much more likely to have early child marriage as opposed to people who were in more than primary education. Similarly, the percent of adolescent females who had any children directly associated with the type of education. In the case of Ethiopia, young women who are married are the ones who are sexually active. You have very little sexual activity outside of marriage. That is not necessarily the case in some of the other countries, particularly Nigeria. But for the case of Ethiopia, when you're thinking about early adolescent sexual activity, you're thinking about the same individuals who are getting married early, and that is the same individuals who are having early childbearing. The same study, the same graphs can be seen when you're comparing rural and urban, as you mentioned, and also income. So the young women who are most impacted are poor, rural, with low educational status. So some of our recommendations are directly interlinked. When you're thinking about the solutions, as we've talked in so many places, it's not just the individual, it's also the structural. And while each of these are necessary, none of them are sufficient without the other ones. So in terms of economic empowerment, really recognizing the most vulnerable individuals, the most vulnerable young adolescents, the vulnerable situation of migrants who are often going from rural areas to the city to work as domestic workers, those who also may go and work as farm workers, and those who are actually migrating to other countries, particularly Saudi Arabia. So they don't have the same connections. They also don't speak the same language, and that vulnerability and isolation those individuals face. Financial literacy improvements and life skills. And Daniel will be talking in the next and also later on about some of the interventions they're doing in Nigeria, which are very similar to some of the great promising interventions that Population Council and others are doing with literacy and programs like that. Education, again, is supporting those incentives to keep girls in school. This picture is an example of a girl who was able to graduate, and when she graduated, then her family received a goat. So it's showing that education is valued and appreciated. In addition, Ethiopia is making a huge effort at increasing access to education, so more and more people are continuing on to the secondary and university level. At this point, most of our focus has been on people in the primary education because that is the majority, but recognizing that comprehensive sexuality education is a possibility and should be further addressed at the secondary and university level. And finally, in terms of health, this is what was mentioned previously about youth-friendly services. We found that youth-friendly services that were actually at the health center were not necessarily being used. There were too many restrictions for people getting there. In contrast, the health extension workers in that effort, by going to the actual households, you make a much better possibility of increasing that uptake. The health extension workers, however, often are ignoring or not recognizing the needs of adolescents, so increasing that training and sensitization for their needs. Thank you.